There we go, Bria. It should be recording now.
Awesome. Okay. Awesome. Thank you.
No problem. Just again, I can't express the importance of knowing your username and password for the exam. I'm not sure if the professors told you that you need it, but you definitely need it. After your exam is complete, also where you'll see HESI, a student assessment here. Well, you can't really see what I'm pointing at, but as you see on the screen, that will appear on your Evolve account. Once your exam's finished, probably within 48 hours, they'll send you a detailed report where you need to improve, what went well on your exam, and basically lists out all the concepts for you to actually go back and reflect on. And this is basically what it looks like on the inside. When you get into that HESI report, 48 hours or 72 hours after your exam is written, it will have everything. It has your exam, the date it was taken, your HESI score, and if you developed any study packets for that exam. The HESI score, I'll chat a little bit about that. That's a little bit different than what you're actually used to seeing on how we're actually scored at the university. That is scored as an NCLEX examination. So to pass an NCLEX, it's anything above 850. So after you're done writing your exam, your score will pop up on your screen as soon as you hit the final submit button. And that score can go up to like 3 digits or even 4 digits. So an NCLEX pass is 850. And don't worry, like if you don't get that 850, does not mean that you failed your HESI exam for the university, because that's not the case. It's just letting you know that where you are as a benchmark. And just to reiterate what Bria said, when HESI, when we do these exams, CBU has the highest success rate for NCLEX passing. That's involving all the universities within the Atlantic provinces, because our HESI examinations are worth, I'm not sure what the value is that you're actually going to write it, but as you get progressing through the terms at CBU, you'll actually, it'd be worth like 50 to 60% of your mark. So just keep that in mind. That's why they're so important, and it preps you very well for the NCLEX. And now getting into the juicy stuff, what you all are all here for, basically.
Yeah.
Rhea, you can start it off if you wish.
Awesome. So I did want to add just onto what you were saying about how it preps you for the NCLEX. Is basically, so yeah, so our school, if I just wanted to say too, if your mics are on, could you please turn them
Louisa?
off?
Oh, she's at work at the moment. Who is this?
Bria, I'll just go through and mute everybody until it's question time.
Okay, awesome.
Probably calling her phone number at 902. Sorry, it just
Okay. Sorry, I kept getting muted too. So CBU kind of puts it at a higher percentage than say X or Dow would, and there's been a lot of controversy over that. That can like be really upsetting to some of the students, like why is ours worth so much? And we've had a lot of conversations and questions asking the same thing, because it is kind of daunting. Like that's a big percentage to add on to your clinical mark. But essentially, so it is here to prep you for the NCLEX. And CBU has one of the highest, if not the highest, NCLEX passing rate for the first time around, in the province at least. So, and this is one of the tools that we use to prep for that. So I know term 3, the NCLEX sounds like it's so far away, but like when you come to start studying, you've been studying since term 3 by taking the HESIs. Okay, so term 3, what should I be prepping for? What should I be studying? I'm going to tell you right now, there's no way that you can study everything from your whole semester in preparation for this exam. It wouldn't even help you really if you did. The concepts, yes, like concepts, your lab values. So take a look at your lab values, kind of know the basic ranges. There might be some questions that are, oh, their so-and-so level is this. And one of the options might be it's a normal result, or call the doctor immediately, or something like that. So you kind of need to know like a roundabout. Select all that apply. I'm sure those have been haunting you all term because they still haunt us. I don't even know what to say about select all that apply, Travis. What do you have to say?
Yeah, if I can offer any advice, I would say treat them as a true and false. Go through each one of them, and if it's a concept that you're familiar with and it has a list of symptoms, just go through it and say, okay, is that true or is it false? Like, just try to treat it as that, and hopefully you can get through it. But that's what I've been doing, and I find it helps actually.
Yeah. Also, full disclosure, this is just our opinions and our experiences with HESI. So take it or I'd like take it or leave it kind of deal. Like don't put everything in our basket. But we're just here to hopefully clarify, maybe give you some guidance, talk from our own experiences. But by all means, do what you need to do in order to study and feel prepared for the exam. So with that, if you guys have gone into NCO, I know like my term 3, I wasn't super familiar with NCO and the custom adaptive quizzes specifically. But you can go through and the custom adaptive quizzes will give you questions that are like that style question like I was speaking to previously. And so it might be good to practice some of those questions. You can put in specific concepts. So preferably the ones that you guys covered this term. Do you have anything to add to the custom adaptive quizzes, Travis?
I do actually. It's funny because I was chatting with 2 other term 3 students there last night, and we were chatting about the custom adaptive quizzes. They're very beneficial, especially when it comes to your HESI, because there is a section in the custom adaptive quizzes that is geared towards HESI. But if I can offer any suggestion, try to do it in a study mode and not into the actual exam mode. Because when you get into like term 5, for say, you will actually be tasked to do masteries of different concepts through NCO.
Mm-hmm.
I know this sounds a little bit foolish, but when you get up there and start doing your custom adaptive quizzes, and if you're in exam mode and you're continually getting something wrong, it's going to prompt you to get more questions right so you can move forward to get a score of a mastery level. So if I can offer anything, just keep that in mind, just to try to keep it in study mode rather than exam mode, because you'll benefit from it when you get up into like term 5 and 6.
Mm-hmm.
So with that said, we did gear a few questions for you. So
surprise.
yeah. Some of the questions that we did, it's going to come up as a poll. You can answer them. I'll give you a minute to answer the questions. And by no means, this is not anything towards marks or anything like that. It's just gearing you if you have any questions for us, if we can actually help you along, pick out the correct answer. But I do believe I have 4 questions, and we'll start with the first one here.
Okay. I don't even know what the questions are, so and I'm popping up for me. So
Bria, can you see the poll there?
yeah, I can see it.
Okay.
I'm gonna answer it too, whether it's right or not.
And just so you know, I can't see who's answering the question, so feel free to answer away.
Even if you take a guess at it.
That's right. All right, I'm going to end that poll,
Okay.
and I'm going to share the results with you.
All right.
So the correct answer
Hi
is
there.
temperature.
Hello.
No, I wasn't able to see anything. I
Oh, you
think
can't.
even some students, yeah, some others saying that they were not able to see anything.
Right. Sorry, you broke up a little bit, but I think what you're saying is that the poll didn't show up and a few people in the chat had the same problem. So we'll try, we do have 3 more, and we'll just see if it works because sometimes one might show up and sometimes might not. But can you see the results?
No, I don't see anything. It's just your video, and I think this is a slide still saying study tips / prep.
Okay.
Right. Joey, are you on your phone by chance?
Now I'm on my laptop.
Oh, okay. Usually if you're on like a mobile device, it wouldn't show up, but
So Trav, why don't we read the question out loud for people that didn't get to see the question? And then we'll just discuss it quick.
yeah, sure, Bria,
Okay.
that's perfect.
Okay, so a homeless adult patient presents to the emergency department. The nurse obtains the following vital signs: temperature 34.8 degrees Celsius, blood pressure 100/56, apical pulse 56, and a respiratory rate of 12. Which of the vital signs should be addressed immediately? So this is taking us, we have some values. So our fundamental values, of course, you know the ranges. So that's something that you're going to need to know, like the ranges of the respiratory rate, your heart rate, your temperature, your blood pressure. So with that one, the most abnormal value was the temperature, which was really low.
Right.
Okay, so that kind of touches on, like the nursing process and the fundamentals of nursing.
Right.
Values, really. So when you approach a question, always think the nursing process, ADPI. I'm sure that's been drilled into your head. So you're gonna just apply ADPI to literally every question, and ABCs if it's an emergency question. Airway, breathing, circulation. What needs to be done first? What's priority? A lot of times there's some questions and there's like an off number, like in some of their values, and then there's like an emotional need. That one tugs at me. That's a hard question for me because I want to like hug everyone and make sure they're okay, as a nurse would want to do. But of course, you need to recognize when a value might be, no, this is serious. This needs to be addressed before they get their cup of tea or something, you know?
So true, Bria. It's so true. And like you'll see in the next question, I believe AdPi will come into effect. I'm just going to launch it right quick so we don't have
Yep.
to bore them with questions. But
Perfect.
all right, the poll should be live there. You should have a quick look at it.
Okay. Is anyone not seeing the poll? Awesome. Becca, okay. All right, Becca, I'm just going to read it out loud. After completing a thorough assessment to formulate a patient database, the nurse should proceed to which step of the nursing process? Diagnosis, planning, implementation, or evaluation. After completing a thorough assessment to formulate a patient database, the nurse should proceed with which step of the nursing process?
I'm just going to end the poll there, Bria.
Yep.
And there's the results. So this question is, if you were to read it very carefully, you'll notice the word assessment. The assessment is complete. So we're just going to move to the diagnosis aspect of it, right? So following that ADPI mnemonic, and I think reflecting back on actually taking the time to read the question, it really helps. Don't try to rush it. I think you're given quite a bit of time to write this exam anyway. So just try to take your time and try to relax the best that you can, especially when you're writing the exam. I'm going to pop one more question up at you, and after you're done answering it, we'll talk about it. Because it's something that you guys had not covered as of yet.
Ooh, tricky. Oh, yes. Sorry, Becca. Okay, I clicked out of it, but the question was, your patient is ordered 7.5 milligrams of prednisone PO. The available medication is in 5 milligrams. 5 milligram tablets, is that it correct, Travis?
Yes, Bria, yeah.
How many tablets do you give your patient? So your patient is ordered 7.5 milligrams PO. The available dose is 5 milligram tablets. How many tablets do you give to your patient?
I'm just going to end this poll right now.
Yep, sure.
You guys are on the right track, and you know that's excellent, because on your HESI that you're about to take, there's about 3 or 4 questions that are medication related, and I know that you did not do pharmacology yet or doing any type of calculation for your dosages. But how do you know, like, don't go and try to stress out over these questions. They are just given to actually for them to see where you are with your knowledge. And there's going to be some questions on there, like some sort of illness or disease that you did not touch on. And there's going to be 1 or 2 questions on the exam regarding that. It's just to measure your results. Like, it measures your knowledge where you are. And like I said, don't panic when you see these questions. How to answer the actual dosage question. And if it's probably going to be in a tablet form, you're going to go over where it has your ordered, your prednisone 7.5 milligrams PO, and then you're going to divide that by 5, and it's going to give you 1.5. And the word scored means that you can actually cut that tablet in half. So that's where the 1.5 is coming from.
And that's a lot of information. And honestly, like, don't freak out, because please tell us the answer, because I still can't see it. The answer is 1.5 tablets.
Yes, it is. Yeah.
So it's really just, if you take away all the medication stuff, it's just the numbers. So you need 7.5 and you only have 5. So it's going to be 1.5 tablets. Don't freak out. If you get it wrong, you get it wrong. I most definitely got it wrong. when I took my first HESI, and I just want to say that probably my biggest mistake taking my first HESI was reading the question and being like, oh my God, I don't know medications. I don't know that condition. Oh my God, I don't know anything. And I'm freaking out. And then I say, okay, well, here I am. I'm sitting here for 5 minutes reading this question and just going to click something. But that was the when I realized that the idea is to carefully read the question. If there's a condition that you've never heard about, look for other context clues. That's when you break out your ad pie. Okay, what is this question asking me to do? Is it an assessment? Is it saying that they have blue lips? That's an oxygenation. Okay, so then you go from there. So don't freak out if there's a condition that you've never heard of, because we can almost guarantee that there will probably be something that you've never heard of on there before. But just go back to your ad pie, your ABCs, and Maslow's hierarchy of needs. Cannot stress those enough.
I definitely agree, Bria, for sure. And I am going to be sharing a document. It's from Barbara O. I don't know if you guys have it already, but this document is absolutely amazing. It has every bit of your lab values in there. It has fundamentals in there, the ad by process, the nursing process, the Maslow. So I'll send that to Sarah and Morgan, and they can post it on your Facebook page. Excuse me. And it's going to carry you through, like, you'll use it until you graduate, because I'm still using it.
Mm-hmm.
And it's an excellent resource. I think we touched on everything there. Bria, do you have anything else that I can't see my screen because I got the participants up in the chat?
Yeah. Yeah, you're just still on the study tips and preps. I guess we can just open the floor to any questions, because really this is all about what you guys want to know, what we can help you with or guide you with. I hope that anything that we said didn't present more confusion. But feel free if you wanted to ask, like, total no judgment. We've been here, like we were here last year. How many questions are on the exam?
If I can recall correctly, I think there was like 83 on the exam.
Very exact. I would trust Travis.
And also, I want you guys to be able to speak up. Like, there's no professors here. I made sure that talk freely. We're here as students. We're here as, like, helping each other.
Mm-hmm.
So any questions that you guys have, we're here to hopefully answer them and guide you in the right direction.
Absolutely. Did that, like, make sense? Did what we said help at all? Also, if anyone wants to tell me the date of your HESI, I'd love to know that.
It was super helpful, and it's on the 16th.
Ooh, awesome. That's the day before us.
Yeah, we're writing a HESI right after you guys.
Yeah.
Is there a time limit? Can you go back to the questions? You cannot go back. Once you answer that question, that's it. There is a time limit. There is a timer up in the top right-hand corner, I believe, when you're writing your exam. But I can't remember how long it was allotted for us to write. But I think that information would come from your professors. I think it is like 2 hours or 3 hours that you're allotted for the exam.
Yeah.
Is the scoring like standard testing?
Yes. Doesn't make total sense. Yes.
Yeah.
Travis spoke to that earlier. You can touch on it again, just about the numbers, number-wise.
Yeah, sure, Bria. Sorry, I just have some screaming kids in the background.
Oh, that's okay.
Yeah, the scoring system is totally different from what you're actually used to seeing. It is scored as an NCLEX, as if you were writing the NCLEX, and So an NCLEX pass is 850, and it's scored exactly like that. So you're going to be looking at 3-digit numbers. Like my first HESI, and I'm telling you, I I got 836. So I did not pass that aspect of the HESI, but I
Mhm.
passed it for the university. So you only progress from there, right? Because after your HESI is written, as soon as you hit that final submit button, that score comes up on the screen. I think it's at the top, but it will give you a score. You can look at it. Don't freak out, because you know what? It indicates nothing. If you're 850 and above, perfect. You know that you're going to pass this, like you pass the NCLEX for say in a term 3 setting. Um,
Mhm.
but if you got like a 500 or a 600, don't freak out, because that doesn't mean that you failed at all. Um,
Right.
it's just guiding you towards being successful when you're writing your NCLEX.
Hmm. Absolutely. Yeah. So unfortunately, there's no way to say, okay, say if there's 83 questions and each one is 2 points and I need to get this many. There's no doing that because I mean, we at least don't even really know because it's scored so differently.
Yeah,
Um, and the idea is that the HESI is harder than the NCLEX. So that's why 850, like that's for HESI, like that's really, really good. So if you get, like Travis said, in the 500, 600, 700s, not a not a problem at all. You
yeah,
chalk it up to, here's the experience. I know what to expect next time, and I'm continuing my learning. Of course, do your best, carefully read the questions, but it's not do or die to get an 850.
exactly. And I can't stress that enough, because when I seen the numbers, I was like, we didn't know what that meant at all. We just seen numbers, and we were told, don't worry about those numbers, they mean nothing. But when your student assessment comes out 48 to 72 hours later, you're like, okay, those numbers actually meant something. Um, and after that does come out, take the time to go review that report, because it shows where you really need to improve or what you went well with. Like
Mm-hmm.
it guides you, it helps you. So take the time to read it. And if I can offer anything, just have a good sleep before the exam and try your best. That's all you can do. You've been learning material since you started, and it will come back. It will, honestly, when you're thinking about questions, it will come back. But I know it's stressful. I'm here like preaching to the choir, because
I
I've been
know.
there, and I still get nervous when I write mine. So, you know,
Yeah, me too. Yeah, and so like Travis said, get a good night's sleep, know your login information. I'm gonna just come out and say it. I was that person that everyone had to wait for because I didn't know my login information. So make sure you know it. um, okay, so someone asked, is there any way to find out your percentage out of 100 that CBU will use towards our clinical mark?
I do not know how they do it. Honestly, I do not know. I know every question is weight, it's differently weighed, because when
Mhm.
you answer a question, you can watch your score fluctuate as you're writing the exam. Um, yeah,
Okay. So short answer, no, we don't know.
we don't know. No.
I'm sure there's a way, but we don't know what that way is.
Yeah,
Um, so for studying, we shouldn't try to reread every chapter from the whole semester, right? No, don't do that.
yeah,
First of all, that's just gonna stress you out because you're gonna have a giant checklist and you're not gonna get through it all. And even if you do get through it all, how much are you gonna retain from reading through every chapter? No, don't don't do that to yourself. So focus on trying out some of those custom adaptive quizzes. Put in the HESI type questions, put in your concepts. You can specialize it. Go through, if you have your notes through, technically you should have read the chapters. I know how that goes. So use the like Lewis has chapter bullet points, and I know Giddens has good resources too. So like if you have your concepts, go through your concepts and say, okay, what are the most important things that we learned from gas exchange this term? And okay, if I have a patient that has an issue with gas exchange, what's it gonna look like? Like we said before, like, okay, blue lips, or like long-term gas exchange, like clubbing or things like that.
Yeah,
So
I definitely agree, Bria, 100%.
yeah,
I just want to, I'll show them that document that I'm gonna send to Morgan and Sarah just to upload to their Facebook page.
okay.
Um, so this document, I don't know, can
Yep,
you
I
see
can
it,
see it.
Bria? Yeah, okay. Can everybody else see it?
Yep.
Awesome.
Perfect. So this document is by Barbara O, and this document was passed down like from the term that just graduated. So they passed it on to us when we did the testing as well. So fast forward to all this stuff. So here are your vital signs. Like everything's just compiled into one document, and it's wonderful. Honestly, it's excellent. Your vital signs. Don't worry about your medications. Some lab values, just to have a quick gander at those. Um, I don't believe they covered that.
I don't think so. Don't let this stress you out.
No, not at all. And like a little review of your ABCs, your nursing process. There's stuff in here that doesn't apply, but you'll actually use it as you move forward in the program. I believe that you went over in your assessment with Janet some crackles, some wheezes, bronchi, all that lovely stuff. But, and positioning. I found there was a lot of questions in regards to a lot of fundamentals, especially if a person uses a cane, what foot should they put forward? Just go back through and have a quick look at those as well.
Right. So yeah, so in my experience with my first HESI, I found that it was more stuff geared towards what you were able to do in your last clinical rotation. So things like whether it was bed baths or turning or like
Assessment wise as well.
assessment, big time assessment wise. So things, yeah. Don't worry about stuff that like you're going to learn. Like don't worry, don't be like, oh my God, it's a practice NCLEX. There's so much that I haven't learned yet, because that stuff isn't gonna be on there. It's geared more towards what you have had experience with so far. And like Travis said, there might be some freak questions in there, just basically to gather data to see kind of where you stand. And that is okay if you don't know it. Yeah.
Yeah.
There was another question that we didn't get to. Does A50 correlate at all to how many questions you got right, or is weighing different for questions?
I
don't know the exact answer to that, but I think the weight is different for questions, because I want to say like select all and multiple
Well, you can
choice.
see your score as you're writing the exam. It fluctuates, so you'll get to see actually what question weighs more, I guess, if you will. I don't know if you noticed that, Bria, when you were writing last time.
I've never noticed that.
Oh, really?
Yeah. So now that's gonna probably stress me out, but
Yeah, I shouldn't have told you.
nope. See, like guys, here I'm gonna take my fourth HESI.
Yeah.
I'm freaking out in my own way, but I'm still here. If
Yeah,
I'm still
exactly.
here, you guys are gonna be here. I can tell you that. It's gonna be okay. Don't stress we stressed so bad over our first one. It is gonna be okay, I promise.
Yeah, absolutely. Any other questions that we can
Yeah.
answer? Did we miss any?
Between now and then, totally feel free to send us a message, whether it's our society Instagram or individually on Facebook. If you wanted it to be more private, absolutely. Like we were totally here for you guys. And like Travis said before, there's no teachers here. So like if you want to ask a question, totally open for them.
Yeah, absolutely.
And no judgment whatsoever.
If anything, we're all in this together, so we're here to help if we can. Ask away. Are you guys obviously doing it at home, right? And you're going to be proctored through Zoom? Is that how you're doing it this term? Or do you know? It's like crickets in here.
Yeah, I know. Yeah. Thank you,
Morgan,
Becca.
I know that you're here. Morgan, you guys doing it through Zoom, like being proctored through Zoom?
Yeah, that's what we were told. I think we're getting split into little groups, and I think
Yeah.
everybody got an email on who's proctoring their exam.
Awesome, perfect.
Yeah.
Right on. Yeah, we're
Awesome.
doing the same thing. Same
Yeah.
thing.
Cool.
We'll give it a
Well,
few minutes, Brianna. And
yeah. If there's
any questions.
anything else, I know I'm trying to think. So ad pi,
Yeah, just try.
agencies, hierarchy of needs. I would definitely say be comfortable with your hierarchy of needs, because they're going to want you to prioritize your nursing care. So that's something that you guys would have done whether you knew it or not in the last couple weeks over clinical. Hierarchy of needs. So awesome. So it could be like an emotional need could be an option, and then like a more physical need, and something about like self-actualization. So it's just all like, okay, so what comes first? It's like self-acceptance versus society acceptance, and just be familiar with where those things lie, because if you come up to a priority question, that will really help you. So it's all thinking. Yeah. There probably won't be questions where it's like a definition and you're like, oh, okay, memorize that. Like I can guarantee you're going to have to sit and think about like most of the questions. Critical think.
Yeah, and I think you guys experienced that through like Cindy's exam,
Mhm.
a little bit of Barb's exam. Like you experienced to actually how it's formulated, like an NCLEX style question. I think he's been through that already.
Yeah.
Cindy's practice questions in class were like that. Yep.
Yes, exactly. Because that's exactly how they're going to be on the HESI. They're going to be on the NCLEX.
Yeah.
And like I said, whether you realize it or not, you did it in your last couple weeks in clinical.
Exactly. And it's no different, honestly. Like Socratic quizzes that Cindy puts up or whatever she uses. Well, I don't know what she uses online, but she definitely gears her questions through NCLEX, and you guys been answering them through since you started up basically. So you should be fine. Like I wouldn't stress much. And like Bria said over and over again, we can't go back and try to reread everything from when you started, because that would be highly impossible and you would stretch yourself out.
Yeah.
You know. But if there's some little tips to go over, is those few little tips to take into consideration and move forward with that, I'd say.
Yeah. Yeah, so like between now and Wednesday, don't go through. I mean, obviously we're not going to tell you how to study.
No.
We're just speaking from our experience.
Yeah.
I wouldn't go through and try and like read a bunch of chapters. I would look over the hierarchy of needs. I would like condense some of my notes that I've learned just to know, okay, what would I do in this situation? Like I said, with gas exchange or mobility. And just prioritize the needs and look over some lab values. Don't Do not drive yourself crazy, because you don't know everything, and you're not going to know everything. I don't know everything.
That
I
is
still
right.
won't know everything until I'm maybe 30 years out in the field.
That's true.
So you're not going to know everything. And that's okay. It's okay. I just like, I can't even express that enough. Like, I know you guys are going to stress in your own ways anyway, but you will be okay. Our teachers are fantastic. They teach you in a way that you think you haven't studied, but you've been studying all semester.
Yeah.
Just because of the way that they get you to do assignments and the way they do their tests. So trust that you've put the work in all semester, because that's the foundation of it. And just do some simple reviewing.
That's so true, Bria. And they made it through the rush of their exams to get out to
Yeah.
clinical. So
Exactly. Yeah.
you guys are going to crush it.
Yes, it's going to be great. And like we said, if you have any other questions between now and then, feel free to either ask now, send us a message. We're here to help.
Yeah, exactly.
Mhm.
And I'll send this over to Bria and she can upload it to YouTube just in case anybody missed it. I'll
Yeah.
send those that document over to Morgan and Sarah, and they can get that posted to your Facebook page. And yeah.
Awesome.
All right. Any questions before we head out?
Oh, you're welcome, guys. I really do hope this helped.
Yeah, honest. And I wish us all the best because I know it's stressful, but you guys will do great.
Yeah. Yeah. Good luck, guys. And congratulations on your first placement. That's so exciting.
Yeah, that's awesome.
Thanks, guys.